Dr. Zaheer Shah, who is a hospitalist in Phoenix and is board certified in internal medicine. Dr. Shah, it's great to have you back. When you look at the fact that we're seeing this sharp increase in all but 3 of the 50 states here in the U.S., where do you think we're lowering our guard?
Well, Kilmeny, to discuss that, I think we have to look at the stark data that we have in front of us. 11.5 million cases in the United States, over 250,000 dead. Yesterday, just yesterday, 1,707 Americans died as a result of COVID-19, the highest number that we've had since May 14th of this year. This is the third time that this pandemic is really posing an existential threat to American life. And I think it begs the question, why can a country that otherwise is known for exceptional science and exceptional scientific development and progress, why are we struggling with this pandemic? And I think that the answers to it are complex. I think we have unnecessarily politicized what should have remained just a scientific challenge for Americans. And because it's been politicized, and it's been politicized at the highest offices in this country, I think that you have a significant segment of the American population who continues to believe that masks don't work, that social distancing doesn't work, that somehow this is actually some sort of a fear-mongering technique used or tactic used either by the deep state or some other entity. You pick your choice of conspiracy. And as a result of that, we as Americans can't get the basics right, which are that social distancing and wearing of masks is an effective way to mitigate this. And what America is waking up to is that the winter has finally come with respect to COVID-19. Keep in mind, for the vast majority of Americans, we're now moving indoors because of colder temperatures. And we also have the concurrent flu season beginning. I am quite concerned that we are now on the brink of perhaps the worst outbreak of COVID-19 deaths that we've seen thus far.
You absolutely raise a great point there, Dr. Shah. I was in Florida last weekend, and it's remarkable the number of people, especially in the vulnerable category, the elderly population that's down there, sort of the snowbirds that are not wearing masks. And you look at some of these restaurants where there's no social distancing happening, there's no mask wearing, and there's nobody really enforcing that at the local level. But I want to touch on something that Dr. Anthony Fauci said, too, which is right now we're seeing a resurgence, even in places probably like Washington, D.C. They're a little bit more disciplined. We're hearing that actually a lot of these cases are cropping up from small gatherings. And I guess that's probably a big concern here as we sort of head into the colder months. And you look at, the fact that this is a time where a lot of people gather with their families for Christmas, for Thanksgiving, for Hanukkah. I mean, what would you say there in terms of families getting together for the holidays and how to stay safe?
Well, I think that Americans are going to have to take the long view on this, which is that holidays are for getting together. But if getting together means that some of your relatives could potentially die and not be at next year's Hanukkah or next year's Christmas, then maybe an ounce of prevention is going to be worth that horrible pound of ultimate cure. In order to do that, we have to consider, I have never seen anything like this. It's almost like a Greek tragedy that's unfolding where Americans, I think, know better, but because literally we have a lame duck president who himself didn't wear masks, who actually made fun of his opponent for wearing a mask, that unfortunately has bled down into those that follow that ideology or follow that line of politics. And COVID-19 doesn't care if you're a Republican or a Democrat. If it gets access to you and you're vulnerable, you're going to get either very sick or potentially die. 1,707 Americans met that ultimate consequence of COVID-19 just yesterday. And I honestly don't know how to get this across. I practice here in Phoenix, Arizona, and even though Phoenix has Maricopa County, I think, tipped towards the Democratic side and ended up voting in its majority for Mr. Biden, there's still a substantial number of people in my practice even who don't believe in masks. Yesterday, we had a patient, a brand new patient, come to our practice who refused to wear a mask and demanded an explanation as to why she had to. And we had to walk her out of the practice because she was a threat to other patients as well as to my staff. The fact that a doctor
Yeah.
in 2020 would have to have this conversation with a layperson, where my opinion as a medical doctor who has had a sufficient amount of training to be able to understand epidemiology, virology, and the nature of pandemics, that I have to have this debate with every single person potentially, is really not telling of the fact that the democratization of information through the internet has made all of us experts. It speaks to something deeper that is becoming broken in our society, where even ordinary people that should be relying on experts like myself to be able to get a more informed understanding of what they're facing in terms of risk are instead discarding my opinion and walking with their own opinion, which may lead to fatal consequences. And I don't know if masks or social distancing can fix that.
Yeah. It's funny, Dr. Shah, I guess I wouldn't use the word funny, but at a time where we should be talking about the science and safety measures, it's impossible not to talk about the politics, because that has become such an, I guess, a pivotal part of this pandemic, and why we're seeing a difference in the way that this is being dealt with. Dr. Shah, we really appreciate you coming back on. Thanks for that.